49-year-old woman presents to the primary care physician with complaints of recurrent episodes of right upper quadrant abdominal pain for the past 2 years. She is currently symptom-free. She mentions that the pain often occurs after a heavy, fatty meal and radiates to her right shoulder. On examination, the patient has no tenderness in the abdomen and all other systemic examination is normal. Blood work shows leukocyte count 8,000, total bilirubin 1.2, prothromboin time 12 seconds, AST 58, ALT 61, serum albumin is 4.1, stool occult blood negative. Ultrasonography of abdomen shows a thickened gallbladder with few gallstones. A HIDA scan was done which demonstrated non-filling of gallbladder and minimum amount of tracer in the common bile duct. Which of the following best describes a histopathological feature in the gallbladder described in this case? A. Neutrophilic infiltration with vascular congestion and fibrin deposition in the gallbladder. B. Minimal lymphoid aggregates. C. Entrapped epithelial crypts seen as pockets of epithelium in the wall of gallbladder. D. Hyalinized collagen and dystrophic calcification in the submucosal layer. E. Abnormal deposits of cholesterol ester in macrophages in the lamina propria. Patient has symptoms for past 2 years. Right? There is right upper pain. This is a woman in her 40s. Pain occurs after heavy meal. What is the diagnosis? Come on. Yes. It's chronic cholecystitis. Okay, good. Reading this much will give you an idea of the diagnosis of chronic cholecystitis. Because acute cholecystitis, what happens is the patient presents acutely and the pain is increasing. And the patient will have to see the physician then and then because of sudden onset of pain and increasing pain. But here the patient has abdominal pain since the past 2 years and it is on and off. It occurs after heavy fat meals when the bile is released from gallbladder. That's why after heavy fat meal, the patient has right upper quadrant abdominal pain. Okay. HIDA scan and all. It's outdated, but it's given in the question. It will not show visualization of gallbladder because of block. This is the gallbladder, and there is an obstruction over here, so there will not be any uptake, and gallbladder will not be visualized. What is the histopathological feature of gallbladder? This is something you have to remember. This histological finding, which is the answer here, entrapped epithelial crypts seen as pockets of epithelium gallbladder. This is called Rokitansky. Okay, this is called the Rokitansky-Aschoff sinus. I'll just describe it over here. Suppose if this is the gallbladder epithelium, this is the layer beneath it. This is normal, and in case of chronic cholecystitis, what happens is here there is this sinus formation. Okay, this is a layer beneath it, right? This sinus formation, entrapped epithelial crypts. This is epithelial crypt. It is entrapped in the wall of gallbladder. So if this is a column, this is how it's seen. Okay. This is a microscopic finding. I don't think you'll be given a histo picture where you have to spot this. This is something that happens. This is a classic finding in case of chronic cholecystitis, and it is called Rokitansky-Aschoff sinus. Okay. Now let's have a look at the other options. Neutrophilic infiltration with vascular congestion. This is a classic description of what is seen in case of acute cholecystitis. Right? If this is obstructed, backup of bile, it will cause stasis and it will cause pressure on the gallbladder. This will lead to edema of gallbladder wall, and eventually because of stasis, there will be bacterial migration and inflammation. Inflammation will cause neutrophilic infiltration. Because of the vascular congestion, and eventually, if you remember the stages of healing, there will be fibrin deposition subsequently, right? So this is a description of acute cholecystitis, which is not seen here, because the patient has had on and off pain since the past 2 years. So it is a case of chronic cholecystitis, also occurring due to cause. Minimum lymphoid aggregates. Now here, even in case of chronic cholecystitis, there will be increase in lymphoid aggregates, right? Because of inflammation. More lymphocytes will be called at the site of action. Minimal is wrong. There will be an increase in lymphoid aggregates to fight off the inflammation. Hyalinized collagen and dystrophic calcification in the submucosal layer. Now, why is this option wrong? Do you know? Look at this. There is no submucosal layer, if you remember, in gallbladder. So this option is wrong. Abnormal deposits of cholesterol ester in macrophages. Now, this is a very rare condition given this option, but since it's an option, I'm going to discuss just briefly. This is a case of strawberry gallbladder cholesterosis. Here, yeah, you can Google the pictures. The entire inner lining of the gallbladder will appear like sort of a strawberry red, and there will be deposition of cholesterol. So the yellow color cholesterol particle here will appear like the seeds of a strawberry. Right? So this is a condition called strawberry gallbladder, and it is seen in cases of cholesterol first. Sometimes it may occur. It is a rare condition, cholesterosis, right? So here it is a case of chronic cholecystitis, and you have to remember this description of epithelial crypts in the wall of gallbladder. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.